treatment group video for trauma and stressors related disorders. My name is Lena Lange-Kram. My client is Buck O'Brien, and he's 36 years old. The differential diagnosis for my client are acute stress disorder, which has been ruled out because he's been symptomatic for longer than a month, and post-traumatic stress disorder, which has been ruled in because he's been symptomatic for more than a month. The primary diagnostic features include exposed to a traumatic event, persistent re-experiencing of the event which interferes with the person's ability to function, and duration of 1 month or longer. So Buck's story is he is an experienced firefighter who entered a burning building alone where a beam fell on him, causing severe burns over half of his body. He was hospitalized. While in the hospital, the staff was very impressed with how stoic he was throughout the whole process. Once he returned home, however, his demeanor changed. He had trouble sleeping. He had severe nightmares and flashbacks of the traumatic event. He appears agitated and irritable. He paces, his hands tremble, and he's hypervigilant. His doctor noticed that there's been a change in his behavior. He's no longer stoic and looks as if he's barely holding it together. Buck feels a lot of shame and guilt for the accident, as he's a trainer of firefighters and his job is to teach them how to follow safety protocol. He admits to being very jumpy. Recently, he was invited to visit work and an alarm went off, triggering him into traumatic-related symptoms, and he felt very embarrassed and ashamed that his coworkers saw him so shaky and frightened that he had to leave. He's scheduled to return to work, yet feels unable to. He finds himself unable to leave the house alone, dizzy, numb, and detached. At the present moment, he's very depressed and seeking help. The multi-axial diagnosis for Buck is Axis 1, post-traumatic stress disorder, Axis 2, none, Axis 3, severe burns over half of his body, Axis 4, he is a firefighter injured on the job, and Axis 5, he's been assigned a GAF of 58. The theoretical perspectives include behavioral perspective. The client demonstrates 2 faulty learning experiences. His symptoms may be a result of classical conditioning. He may have developed a fear response to a stimuli present in the traumatic event. This could explain his anxiety symptoms when returning to the fire station and hearing the alarm. The client may also be operantly conditioned. He's avoiding stimulus that causes him anxiety and distress, thus negatively reinforcing his avoidant behavior. The cognitive perspective suggests that the client's symptoms could be due to his negative beliefs about the traumatic event and his role in it. He expresses beliefs of guilt, shame, and blames himself for what happened. He expresses a perceived internal threat that the incident was his fault and he should know better to follow protocol. And he now believes that his coworkers will not want to work with him because he made a mistake. The biological perspective suggests that his symptoms could be due to a nervous system being primed or hypersensitive to potential stressors, similar to the traumatic event he experienced. He could have low levels of GABA or increased levels of norepinephrine. He could also have abnormalities in serotonin pathways. And additionally, he could potentially have abnormalities in the hippocampus. Hippocampus atrophy has been found in individuals with PTSD. The last one is sociocultural perspective. His symptoms are the result of his working as a firefighter. This work-related trauma has led to the development of numerous trauma-related symptoms. So this was the treatment group video for Buck O'Brien, and my name is Lena Lange-Kram. Thank you.